Next, we're going to look at the left circumflex coronary artery. We can see that the left circumflex lives in the AV groove on the left margin of the heart, or the obtuse margin of the heart. And it starts at the bifurcation of the left main and has a very variable anatomy. We will see that there's, in about 80% of patients, the left circumflex coronary artery is going to be relatively diminutive compared to the right, and the right will give rise to the posterior descending artery. But in about 20% of patients or so, the left circumflex will actually be relatively robust and will stay a fairly large vessel as it courses in that AV groove and will supply the inferior septum, giving rise to the posterior descending artery. This is an example of a patient who is right dominant, and again, the vessel that supplies that posterior descending artery is what determines the dominance of the coronary circulation. But we have an example of a patient who is left dominant. So this is another patient that, as we scan down, we can already see that the left circumflex artery is a bigger, more robust artery than the RCA, and as we follow it down, we can appreciate that it stays a fairly sizable artery going to the undersurface of the heart and giving rise to the posterior descending artery at that inferior interventricular sulcus. So the left circumflex artery may or may not give rise to that posterior descending artery, and it's actually a smaller percent of patients that are left dominant. So switching back to our first patient, we can see that the branches of the left circumflex artery supply the lateral free wall of the left ventricle at the obtuse margin of the heart, and that's where they get their name. They are the obtuse marginal branches. They'll be designated as OM1, OM2, and so forth. So as we start with the circumflex artery and we follow it from its origin, we can see that there's a fairly early branch off point where we can see this first obtuse marginal branches off, and then the very diminutive LCX continues along in the AV groove. So we divide the obtuse marginal not into 3 segments like the LAD, but into 2 segments. That is the proximal and the distal segment. And again, you may see some nomenclature schemas out there that include 3 segments for the LCX. However, for the purpose of cardiac CT reporting, we simply have a proximal and a distal segment, and they're divided by the origin of the first obtuse marginal artery.